So good morning, everybody. We're here with Dr. Thomas Brown. He's a renowned clinical psychologist who received his Ph.D. from Yale University. He specializes in assessment and treatment of high IQ children, adolescents, and adults with ADD, ADHD, and related problems. Thank you so much, Thomas, for being here with us and sharing a little bit of your time. It's a pleasure for us.
It is my pleasure to be here, and I appreciate the invitation.
All right. So would you like, well, first of all, just 2 minutes is to be so grateful for all what you made personally in my life since 1996. You are my mentor because of the warmth you transmit, the knowledge you also spread along the whole world. So this is a very personal thank you, Tom, for being my teacher for so many years. So helped a lot
I
of
thank
people.
you. It's been an honor to know you and your family.
Thank you very much. So here we are with Luli and for Espacio TDAH, that's ADHD space in Instagram.
Yes.
She's organizing a very nice awareness month for ADHD. It happens to be. So she's gonna share with us some questions so you can talk a little bit of your experience with us and lots of families, okay?
Sure, thank you.
Okay, so firstly, tell us maybe a little bit about yourself. How long have you been working with ADHD and maybe what triggered your interest in the field?
Yes, I've been working in the field of ADHD since about 1980. And developed an interest in ADHD specifically because I was doing consulting work for a school for kindergarten through 12th grade that was near my office. And so I was seeing a number of children there, and in 1 week, there were 2 children, both of whom were very bright students who had been in public school and were doing poorly, in spite of their saying they wanted to do better. And their parents now were paying a lot of money to send them to private school, and they were still having a lot of trouble. And there was something about the way those 2 kids told me, they did not know each other, and I saw them both the same week, but in different meetings, as they explained that every day they would go home from school with their books and their materials, intending to be able to get their work done, wanting to study, wanting to produce what was needed, and that repeatedly they failed to do it. It would not be done adequately. They just were not able to maintain focus. They were not able to organize their priorities in what they were doing. And they were very frustrated, as were their parents, who were feeling like, now we're paying a lot of money for you to get this education, and you're still not able to do it. But you know how sometimes someone can explain to you something in words that you may have heard before, but they just explain it in a different way so you get a picture of what they're talking about. And each of these kids, they did not know each other, and so they were talking completely separately, but there was something about the way they explained the difficulties that led me to think, you know, this sounds a little bit like some of the things that I hear from kids who have the hyperactive kind of ADHD. And this was back at a time when there was not much talk about ADHD without hyperactivity.
Mm-hmm.
And so I thought, well, why don't we try the medicine that we use for the hyper kids and see if maybe this might be helping these kids even though they're not hyper. And we got lucky. We started the medication, and within a matter of a couple of weeks, the students were reporting a lot of progress. The teachers were reporting progress. The parents were reporting progress. And we had something which then became much more interesting for me, because now what I had a chance to do was to talk with them with the medication on board to learn about what their experience had been. And what I found was there were many things they were telling me about what it was like for them to do their schoolwork and to read and to try and organize their priorities and to utilize their memories. And in ways that I did not understand and that were not in the diagnostic criteria for ADHD. And so I began to construct a listing of some of these things, and out of that came rating scales. In 1996, I published my first rating scales for teenagers and also for adults. And then in 2010, We did one starting with 3-year-olds and all the way up to old age. And then in December of last year, 2019, we redid the whole thing with new norms, and now it's updated. It used to be, it was the Brown Attention Deficit Disorder Scales, and now it's the Brown Executive Function / Attention Rating Scales, which are now published and widely used in many different parts of the world.
So Tom, question is, at that time when you were doing all this, they were talking about hyper kids, and these kids were not behaving badly in school, right? They were not referred.
No, these kids that were referred to me were not referred because of behavior problems.
Okay.
And rather because they were inconsistent in being able to get their work done, and they were very bright kids who really wanted to be able to do the work. And that was at a time when there was very little being written or talked about with kids who did not have it. Even today, I think there are many people who still think ADHD or ADD, I use these two terms interchangeably, is really just about kids who have behavior problems who can't sit still and won't shut up and don't listen very well to what people say to them. And what this did was open up for me an understanding of a much more complicated picture. And I would argue that we can now write an equation that says ADHD or ADD equals the developmental impairment of executive functions, the management system of the brain. And I've developed from listening to patients, basically. You know, I read the neuroscience literature, but I mostly talk to patients 5.5 days a week. And so I've developed a model based on what I've learned from them, which has 6 different functions included. But let me say, before I try and explain that, 2 things that are important. One is that all of the problems that I will describe as part of ADHD are things everybody has trouble with sometimes. It's just that people with ADD have a lot more trouble with it. So in that sense, ADD is not an all or nothing deal like pregnancy, whether you are pregnant or you are not pregnant. There's nothing in between. It's more like depression, where everybody gets bummed out once in a while, but just because somebody's unhappy for a couple of days does not mean we're going to diagnose them as clinically depressed. It's only when the depressive symptoms are persistent and making a lot of trouble for them we say, yeah, that's a depression, we should do something about it. All of these characteristics are things everybody has sometimes. It's just people with ADD have a lot more trouble with them. Second thing is, almost any task we do that requires executive function, where you have to manage yourself, involves not just one of these 6 different clusters that I'm going to talk about, but the dynamic interaction of them. Third, and a little more controversial, is the fact that mostly these operate unconsciously, not in the psychoanalytic sense of unconscious, of repression, but rather in the more modern sense of automaticity. They happen so fast that one is not able or does not need to stop and think about the details of it unless you're doing an unfamiliar task, or there's something that's entered into the task which is much more complicated than usual. But that they are so automatically done. Not, it's just like a basketball player in getting ready to do a layup shot does not go dribbling in saying, now I move my left foot forward, now I move my right foot forward, now I drop my shoulder. These are seamlessly integrated operations that are done, even though they have to move around the defenseman and have to get in the right position and have to keep shifting things. So that often we talk about this as focus problems, but it's not focus in the sense of hold the camera still while I take a picture. It's much more like focus on your driving. Because if you think about it, when you're focusing on your driving, you're not just looking at the bumper of the car in front of you. You're watching what they're doing, but you're also looking at your rear view mirror and your side view mirror. You're also noticing a truck that's backing out of a driveway, and you want to be sure that you don't hit it. There are a few pedestrians running across the street to catch a bus. You're trying to shift over to the left lane in order to make a turn at the next corner. And then while you're doing that, you may be thinking about what you're going to buy when you get to the grocery store.
That's right.
It's this ability to ignore this, remember that, look ahead to that, and put all these pieces together. It's that kind of focus that we're talking about. in terms of daily operations with ADHD. And I think that one of the things that I would say about it is it's focusing not with your eye, not only with your eyes, but also with your full mind. But the thing that's interesting to me about it, and I think is puzzling to a lot of people, as it once was to me, and that is I have seen more than 1,000 children and teenagers and adults with ADHD. And the thing that is most puzzling about it to many people, and to me, as I was starting, is every one of these patients that I've ever seen who has ADHD has a few things in which they are able to function without any of the difficulties that they have in their executive functions for most other things. Here's an example. 16-year-old boy brought into the office by his parents, and he was the goaltender for his school's ice hockey team. And it just happened that the team had won the state championship in ice hockey the day before he came for this appointment. And so the parents are bragging a little bit at the beginning about how great he was and how good he was at being able to pay attention and how he knew where that puck was every second of a fast game, totally on top of the kind of goalie every team wants. Smart kid, tested way high up in the superior range, wanted to get good grades, was hoping to go to medical school, but he was always in trouble with his teachers. And what they'd say to him is, once in a while, you'll say something that shows how smart you are. Well, we'll be talking about something, you'll come in with some comment that's really very perceptive and it's impressive. But most of the time, you're out to lunch, you're looking out the window, you're staring at the ceiling, you look like you're half asleep. Half the time, you don't even know what page we're on. And the question they kept asking him was, if you can pay attention so well when you're playing hockey, how come you can't pay attention when you're sitting in bed? There's another example. A lot of times parents will bring in kids for me to see, they'll say, the teacher says this kid can't pay attention for more than 5 minutes. We know that's not true. We've watched her play video games, and she can sit and play those video games, for 3 hours at a time and not move. The teacher said she's easily distracted. That's nonsense. When she's playing those games, she is locked on that screen like a laser, and the only way you're going to get her attention is to jump in her face or turn off the TV. So again, it's like, if you can do it here, why can't you do it there? Now, it's not always sports or video games. There's some people with ADD, they're not good at that stuff. They might be into art, and they're sketching and drawing and really getting into it for hours at a time. Some, when they're little kids, they're playing, they can create engineering marvels with Lego blocks. And then when they're older, they're taking car engines apart and putting them back together, designing computer networks. Everybody I've ever seen who has ADD has a few things they can do where they've got no trouble paying attention. Even on almost everything else, they've got a lot of trouble paying attention.
But that
and
was
what
he loved. That was what he loved. Those issues were exactly.
You ask them about it, you say, why is this? And usually what they'll say is exactly something like this. It's something I love to do. It's just, it really interests me.
Yeah.
And people then will say, well, if you can do it here, why can't you do it here, here, and here? Because those things are important. But the fact is, I had a college student one time who gave me an example that I've thought about for a lot and spoken about a lot. He said, I have a sexual example for you for what it's like having. He says, having ADHD is like having erectile dysfunction of the mind. If the task you're trying to do is something that turns you on, you're up for it and you can perform. But if the task you're trying to do is not something that's intrinsically interesting, if it doesn't turn you on, you can't get it up. And if you can't get it up, you're not going to be able to perform. In that situation, it doesn't matter how much you may say to yourself, I need to, I ought to, I should. You can't make it happen. It's simply not a willpower kind of thing.
Can I ask you a question? So
of course.
Because of what you're talking is so interesting. When you're saying all this, Tom, triggers in my mind, how do we diagnose? And you were talking about your scales and this executive dysfunction. What do you think about all these neuropsychological tests that pretend to try to measure all these different areas?
I think that the neuropsychological test batteries that are usually used to do these neuropsych exams are very helpful if you're looking for a brain tumor, if you're looking for structural damage to the brain. I do not believe they are useful for doing evaluations of ADHD, because in order to do that, you need to know a lot about how people function, not in these little laboratory tests that you do on a table in an office.
Tom, this
is
so
day-to-day
important. Yes, it's so important, because when we are dealing with families and they are seeking for diagnosis, what they get most in Latin America is a very expensive, a lot of bunch of long-term studies that
Yeah.
most of the time say, you know what, this kid is okay.
Yeah, well, they may very well be okay in passing neuropsychological tests because they're trying to measure different things.
Yes, but
And
it's not.
what you need
Of
for
course.
an assessment of ADHD is not a bunch of these little laboratory tests that are done in neuropsych batteries. They're useful, as I said, for structural problems in the brain. If you're looking for difficulties in, sort of the functioning of the organs of the brain and the different systems there.
Talking from your experience, Tom, this is so important for all the people that will be listening to this, because many families are struggling saying, who I see. And I always say, whatever you are going to do, go to seek help with somebody that really knows how ADHD looks like.
Yeah, it's very important because you need to look at cross-situational functioning.
Yes.
You know, it's about how you do a variety of different tasks of daily life.
Mm-hmm.
What things you struggle with, what things you're able to manage all right. And so it's important, I think, first of all, to notice how the executive functions work on things that a person is interested in.
Yeah.
But also to know about how they don't work on a lot of things in which the person may want to do it, but it just doesn't turn them on in the same way. And I sometimes get neuropsychologists angry with me because
I know.
I'm saying that their methods are not useful for ADHD, even though they're quite useful for certain kinds of things where you're looking for brain damage.
Thank you very much. That is important. And the other question, because you're explaining so nicely your model, it's what made you include before DSM, even in DSM-5 are talking about emotions, you were the one that included emotions. This is my personal view of this. You included emotions in this ADHD list for important diagnosis.
I think that emotions are the notion of understanding how people think and operate involves appreciating the cognitive and the emotional function, because emotion is the energy that drives our ability to function and to engage with tasks or not.
Including emotions was a very important from my perspective.
I think so, but there are a couple of specific ways in which this becomes important. Let me just give a couple of examples. A lot of people talk about how, well, let me just tell, one of the fellows, an office guy that I was talking with, said, I was over at the office, I'm going down the hall, and a friend of mine who works in the other department's coming around the corner reading some papers as he's walking. And I hadn't seen him for a long time. So as we approached each other, I stopped and said, hey, what's up? How you doing? I thought we could stop and chat for a minute. He looks up, says hi, puts his head down, keeps right on walking. He said, now most people would blow that off in a minute and figure he was in a hurry. He's got to get to a meeting or something. We'll talk later. He said, not me. He said, that happened at lunchtime. I got nothing done for the rest of the day. I spent all afternoon thinking I'd do something to piss him off, or maybe it is something to offend somebody in his department. They're all angry with me. Or maybe I'm just the kind of person nobody likes and nobody will tell me about it. I couldn't get it out of my head. Other people, it's not like that. They get an idea in their head of something they want to do or something they want to get or something they want to buy. And that desire gets so intense, and that's all they can think about. They'll keep going on and on and on, do everything they can to get this, whatever it is. But even when they get it, it's not going to make much difference because by then they're off on something else they want. Other people, it's not like that.
And you know what, Tom? Your example is about explaining so nicely how you could help clinicians to make a difference between bipolar disorder that so many times, I am specialized in adults, and so many times patients come to my office with a diagnosis of bipolarity, and that is an important situation. If you could share your examples for us of how can, in a very big way, you could explain straight the difference between a bipolar disorder and ADHD.
Well, bipolar disorder is there's some people with ADHD who have bipolar disorder.
Yes.
That's absolutely true. But there are also many people with ADHD who are moody, that they get very angry very quickly, often over trivia. or they get very fearful. And the way they describe it is that the emotion, whether it's the hurt feelings or the pissed off over trivia, or I've got to have it now, or what would happen if all of a sudden just sort of gobbles up all the space in their head. And it's very difficult for them to put it in perspective, to put it to the back of their mind and get on with what they've got to do.
Mm-hmm.
You know, and it's and as a result, their difficulties with these lapses in terms of engagement, their inability to focus, and their tendency sometimes when they get angry to get so angry that that it's like they forget that they're talking with somebody they love and don't want to really hurt. But it just gobbles up all the space in their head. And that can look an awful lot like bipolar disorder. But you need to ask questions about what are the circumstances under which it happens? Where do they have the difficulties? And make a differential diagnosis that's going to look at the whole context of how the person's operating.
Yeah.
And not go by simply, yes, this is a moody person.
Yes.
Because not every person who's moody has bipolar disorder.
Yes. It's important because not only a lot of people that comes claiming they do have ADHD, they do have ADHD because maybe they are depressed and they are not able to pay attention, or they don't have a story in their lives. So
yeah.
Another question, and including emotions, is how do you feel that suffering in all these families with ADHD is like, it's like the impairment ADHD triggers to the person and the family and society? How would you encourage people to seek for diagnosis because of that?
Well, I think the thing that's most important is when you've got a situation where there's somebody who seems not to be able to manage day-to-day operations in the way you would expect someone of that age to do. And there's not any other obvious explanation for it. It makes sense to at least do a rating scale and talk with the person about what sort of difficulties they run into and when these things work and when they don't. And pay some attention to the context, because this is a very stressful thing for parents and for siblings of those who have ADHD, particularly when it's not controlled, because it's very frustrating and annoying. Feelings get hurt. People get very discouraged with one another. And often there's a lot of conflict in families, which, can be worked out if the ADHD is adequately addressed. And remember, we're not dealing with one thing about focus. We're also dealing with a problem in terms of being able to get organized and prioritize. Because many people with ADD will tell you, if I've got a bunch of stuff to do, it all seems equally important. And it's very difficult for me to look at and say, okay, that should be first, that should be second, that should be third. And there's a lot of difficulty with procrastination, which sometimes seems like it's just stubbornness. But the fact is that often people keep putting things off till the very last minute and then have to rush in order to get it done, and the quality of the work at that time is not very good. There are difficulties also with being able to utilize working memory. That many people with ADHD, if you ask them, how's your memory? They'll say, oh, I've got the best memory of my family. I can remember stuff nobody else can remember. They give you some examples of some movie they saw 10 years ago. They have seen it only once and can tell you every detail of the entire storyline of the movie they saw once 10 years ago, haven't seen it since. Or somebody else will say, oh yeah, I went to the Super Bowl back 2 years ago. I can still describe for you almost every play they ran during that game. Or somebody else will say, I have in my head 450 songs were popular back in the 70s, all the music, all the lyrics, all the verses. But even though they might be really good about remembering things like that from a long time ago, if you ask them about something that happened just a couple of minutes ago or yesterday, often they can't tell you. The problem with memory with ADD, it's not long-term storage memory usually. It's more often short-term working memory. It's what you depend on, for example, if you call up the telephone information operator, you get a phone number and you have to hold it in your head while you dial it because you've got nothing to write it down with. Often that's hard for people with ADD. They keep turning the numbers around. Or you go in the other room to get something and you're standing there scratching your head wondering what the hell you came in here for. Or you're working on a project, you go downstairs, get something you need for the project, see something else that's interesting or something else that needs doing. Then you're up to your elbows in project number 2, having totally forgotten you're in the middle of project number 1 upstairs. It was kind of important to get it done. Students complain, they'll be in class, teacher asks a question, they raise their hand, they've got a good answer for it. teacher calls on somebody else first, you have to wait while that other kid says her shtick. Teacher comes back and says, yeah, what were you going to say? It's like totally clueless. Now that I've forgotten what I was going to say, but what was the question again? Or they'll read something, they'll understand it perfectly well at the moment that they read it. Then they read on for another page or so, stop for a second, realize their eyes have gone over every word, they understood every bit of it as they were reading it, and now they haven't got the foggiest idea what they just read. Or what really drives them nuts is they'll study for a test the night before the test. Somebody will quiz them, they've got it. They go into class the next day thinking they're going to get a good grade on this, and all of a sudden a big chunk of what they knew the night before has evaporated. Can't pull it out of their head when they need it. But then a few hours, a few days later, something jogs their memory, it's all back again. It's not that they didn't have it, it's they couldn't retrieve it from memory at the time they needed it.
That, Tom, makes me also, because of my experience as a clinician, know how frustrating it is to be living with ADHD, and how frustrating it is to try harder and harder and get less results. And as we are talking about this all this time, many families are not comfortable about getting their kids or adolescents under meds, even them as adults. What would your thought to the people?
Well, I think if you go online and look for things that are purported to help with ADHD, there are many computer games, there are many diet supplements, there are many restrictions for diet that are proposed, and there's no good scientific evidence that any of those things are really helpful for changing the difficulties of ADHD the way I understand. But what we do, and medicine for ADHD does not always work, but it works much better than most anything else we've got. On average, at least 8 out of 10 people who have ADHD, if it's carefully diagnosed, if they have fine-tuned medicine to treat it, function better. For some, it's huge how much it helps them. For others, it's substantial, but it's not huge. Others, it helps a little bit, but not that much, and 2 out of 10, it doesn't do a damn thing. But it's very important to understand the medicine for ADHD cures nothing. It's not like you have a strep throat, you take an antibiotic and it knocks out the infection. It's more like my eyeglasses. I have a problem with my eyes. I can't read typewriter-sized print without my glasses. Put these on, I read it as well as anybody can. Take them off, I'm right back where I started. The glasses don't fix my eyes. They just help me see when I've got them on. In the same way, the medicines for ADHD can be helpful, not constantly, but during those parts of the day when the medication is covered. But there's one other thing that I think is really important and often overlooked because we don't spend that much time training physicians and other prescribers about this. And that is the amount of medication that one needs if you're working with stimulants for ADHD does not go by how old you are, how much you weigh, or how severe the symptoms are. It's how sensitive is your body to it. There are many medicines that can be very effectively prescribed by so many milligrams of medicine or so many kilos of weight. That's not the way stimulants work.
Well, that's why it's so tailor-made, right? Would be the word.
Yeah, it's fine-tuning. It's tailoring. That's why it usually works best to start with a baby-sized dose and then step it up a little bit at a time, because you're looking for the sweet spot between too little and too much. If you have too little, it doesn't do a damn thing. You might just as well be taking breath mints. If you have too much, then you begin to get jittery, like you've had way too many cups of coffee, or you get really irritable where every little thing is pissing you off way more than it would normally, or you get too serious where you sort of get this blankness where you sort of lose your emotional responsiveness. And so the fine tuning is so important. And at different times of the day, it may be different. But it needs to be fine-tuned to the needs of this particular person at this particular time. With that, the medicine can be extremely helpful. But I think it's also important not to oversell it, because it does not work for everybody.
Okay, and also it's like, it's not just meds, right? You have to
it's not just
psychoeducate parents, family.
Yeah, the most important thing is to have them first understand what in the world this is, and why it's so inconsistent, and to appreciate this is not something that you sign up for. It's a highly heritable disorder. Out of every 4 people diagnosed with ADD, one of them has a mom or dad who's got it, whether they know it or not. Because the old days, they were never any good at diagnosing this, and even today it gets missed a lot. And the other 3, if they don't have a parent who has it, usually there's a grandparent or an uncle or an aunt or a cousin or brother or sister. It runs in families. In science, we use a number between 0 and 1 to say how much something's influenced by genes, where 0 means not much at all and 1 means that's pretty much the story. For comparison, breast cancer is about 0.3 on that scale. Asthma is about 0.5. Height is 0.9 and ADD is 0.76. And that's based on about 20 different twin studies. So this is a highly heritable disorder. It occurs in people across the full range of intelligence. You can be super smart or not so smart and still have ADHD. It's not always accompanied by behavior problems. In fact, many people, the problem is that they're not active enough in being able to do things. And it includes difficulties with a set of cognitive impairments, being able to focus, being able to sustain focus when you need to and shift focus when you need to. Being able to maintain alertness, it impacts sleep. Difficulties falling asleep, difficulty waking up, difficulty staying alert during the day,
and Tom,
difficulties with being able to organize and prioritize things.
Those are very important because it's not just completing a list and just filling the blanks of lots of symptoms. I would like to ask you, what is your experience, because you were so much involved in high IQ and intelligent kids, about sluggish cognitive tempo?
I think sluggish cognitive tempo is a concept which has been developed as a corrective to the emphasis on hyperactivity.
Mm-hmm.
But I think it's a pattern that one often sees in the predominantly inattentive type of ADHD, where many of these people, other than, not being wildly hyper at all, but being kind of sluggish and being able to get turned on. I don't think it's necessary to reclassify it as a different disorder. I think it's just a different variant.
So you perceive that as a different variant of inattentive type?
Exactly.
Okay.
I think it really does exist, but I don't think we need a separate category to diagnose.
Okay, it's important because they're not yet included in DSM, and there are not so many research about that.
I remember one day I was at a conference, this was years ago, and they were getting ready to bring out, I think it was a DSM-4, and a couple of the people on the committee were fielding questions at the annual meeting of the American Psychiatric Association, and they were getting peppered with, why didn't you do this, and why didn't you do that, and this is being omitted. And one of the researchers who was involved in it said, look, folks, you got to keep something in mind. The DSM does not lead the field, it follows it.
Mm-hmm.
And the fact is that at any given time, whatever you're going to be able to get everybody on that committee to agree to as they prepare the manual is going to be not the front edge of what's going on, it's what they can reach agreement on of what's been already established.
What is your best advice about dealing with families with ADHD and telling them about ADHD and helping them understand what it is? What would you say are the most important things to have in mind when talking about this?
I think one of the things which is very important is look for the strengths as well as the difficulties.
Good.
Often when you've got somebody in the family who's chronically having difficulty with some of these things, it's easy to get focused on those problems and to forget the gifts, to forget the strengths that the person has. And I think it's very important for any of us to have other people recognize with us and for us, even when we may not see them clearly ourselves, what are their particular strengths. Second is, keep in mind that you don't have ADHD because you signed up for it. You have ADHD because you've inherited the genetic structure and then, had to cope with it as best you could. And, many of the kids who turn out to have ADHD are kids who have very conscientious parents who have done a lot to try to provide support for them. And sometimes the patient blames their parents and the parents blame the kid, and then they all blame themselves. And the issue is not so much, who to blame, but it's rather how better to understand where the strengths are and what can be done to be able to do it. And the one other thing I'd like to say in regard to medicine, because it's a question that many parents have, is if I put my child on medicine for ADHD, particularly since the controlled medicines are the ones that we use most often because they work the best, they worry, will this increase the kids having a problem with drugs or alcohol later on? And there is good research to show us that show me a kid who's 9 years old, carefully diagnosed with ADHD, I can tell you that that boy or girl has twice the risk of having a drug or alcohol problem at some point in his or her life if they are not treated with medicine. You know, the problem is that the nature of the disorder and the way in which it impairs people in being able to do the things they want to do and need to do is such that often their academic functioning goes down and down, and they end up hanging out with those kids in the school who are least interested in getting their work done.
Right.
And it makes it much more difficult. And the medicine is not a magical thing that's going to fix everything. It doesn't. There are a lot of things that need to be done besides medication treatment. But it's the best tool we have if it's properly fine-tuned for the person, to allow the person to work in their strengths. And in my mind, it's very much like putting on eyeglasses. You know, and to get eyeglasses that work, you have to get ones that are you know, specifically made for you, that'll adjust to your particular eye structure and functioning. And you need to wear them if you're going to be doing anything where you need that corrective lens. But it's the community of support from families and from teachers that allow people who have the ADHD to build on their strengths and to learn how to cope with the things that are more difficult for them.
Although those are amazing things, because I always remember the circle and the square you taught me about, where to put the strengths and the difficulties.
Yeah, actually, right? that and other articles I've written are all on my website.
Yes.
And people can download them for free.
We're gonna.
And it's just brownadhdclinic.com.
We have all the data, and we're going to put it down when we are going to update this. It's going to be a challenge to, subtitle this. We're going to do it together because it's a lot of work, but we're going to share this with this Latin community, and it's going to be a pleasure for everybody to have the chance to listen to you, Tom. As always,
thank you so much. It has been a pleasure to see you both again. And a privilege to be able to contribute to your program.
Yes, hoping to go to California or you to come to BA again. We'll be glad to have you. I'd love to. Okay.
Take care.
Thank you so much. Bye-bye.
Thank you very much, Tom. Thanks a lot.